Hi guys, Dr. Chellam and Marina from Holistic Icon are on our Wednesday podcast.
Hi there.
So I think most of you were aware, if you were following our Facebook page, that we were going to do is Beauty Gut Deep. And a lot of reasons I chose this topic is one of the commonest causes of gut disorder is actually skin disorders. And we don't realize this. People come in with, in fact, I think I was talking to someone and when they were talking to me about their medical problem, and the common medical problem that we all see, skin issue, is eczema.
Yep.
And people think it's almost normal to have eczema. And it's not. Yes, it comes and goes with time. But I've had patients who've had eczema head to toe. You have to ask them. It's a very, not only is it an annoying condition, it actually is, besides the cosmetology part of it, the cosmetic implications of having a skin rash, I think the bigger issue is the chronicity of this problem, number one. Number two, the number of dermatologists many of these patients would have gone to. And it's just different varieties of what do you call creams or hydrocortisone creams that they use. And then, of course, that's probably the variety that does not kill you. But then you have the other, which is the autoimmune skin condition, which will include psoriatic arthritis. So with psoriasis, also you can have small patches or you can have the whole body really affected. And what if I told you all of these are not, the way we approach it is probably just one-sided. I'm not saying skin creams don't work. They do work. But what if we were to target the actual cause of the skin disorder?
So a lot of times when you have a skin condition, I don't think you think it's really that much of a problem. Like you said, it's a cosmetic thing. It's like, oh, this is irritating. It doesn't look pretty.
Yeah.
But you don't understand like that's coming from within. And so it's always like a warning sign there's something else going on in your body. And even a lot of times the creams don't work for a lot of people. So.
They don't work if they stop using them. They work when they're using them, and it doesn't work as effectively. Like I said, the more extensive it is, these creams don't work. And I keep looking up and down because, again, we're on Instagram, just so you guys know, the ones on Facebook. And Instagram folks, we are on Facebook, therefore I will look down for you. But overall, what I want you to understand is skin, when you have a skin condition, it's a good time for you to look at your gut health. It's not just skin deep. If something is irritating the skin. And I'll tell you a story. My son is very, very particular about his diet. I hope he doesn't watch this podcast. I'm probably going to get
in
killed.
trouble for these podcasts.
I know, with somebody. In fact, I told him he should create what they call it, a vlog, I guess a video blog about it. But he had gone recently to Spain for something with his college, and the 2 weeks that he was there, he could not find food that he could actually eat, which he was regularly eating. For instance, he's very plant strong, so in fact he's plant-based, but he was eating a plant-strong diet, and I asked him what went wrong in Spain, because he came back with eczema, and this kid has not had eczema since the age of, I would say, 2.5. And the reason he had eczema at the age of 2.5 was he used to be on a lot of antibiotics up to the age of 2 because he was having respiratory infections. He had what we call the daycare syndrome. When kids go to daycare, they land up having a lot of infections. And so it really destroyed his gut bacteria, gave him the eczema. Over the years, he struggled with his skin issues, but then he completely cleared it up with changing the gut bacteria. And when he went to Spain, he had no other choice. And he said there were so many foods that had numbers on them in the ingredients, E008.
Really?
Yes, there were a lot of processed foods. He came back with eczema on both his elbows. And it was a matter of within a week, it completely changed. No ointments, nothing, just got back to his regular diet. So what I want people to understand is the beauty of the skin is not skin deep, it's actually gut deep. What does your gut bacteria say, and what is happening in there? What I want you to understand is for every cell, skin cell, we have 10 to the power of, I think, 12 bacteria on our skin.
Mhm.
In the gut, we have 10 to the power of 4 for every cell, human cell. So we have more bacteria in our body than human cells.
Yep.
And
Think about that.
yes, I mean, literally, we are basically bacteria.
Mhm.
I think we are a human being living in a bacterial world. And one of the biggest shifts that's happened with industrialization is we try to kill these bacteria constantly, right? We're cleaning and we're trying to get rid of stuff. And therefore, what has happened, we don't have as many infections as we did before, but now we're having allergies
Mhm.
and we're having asthma and all of those things. But coming back to the skin, what I think we want to convey in this podcast is when you have a skin condition, you've been going to dermatology after dermatology after dermatology clinics. You've been using ointments after ointments, and you've also, like in psoriasis, they even get to immunomodulators, which means something that affects your immune system, because this is actually your immune system getting triggered off by something. And it's usually the shift in the population of the bacteria.
Mhm.
In fact, we think the shift of the population in the bacteria not only causes skin conditions like dermatitis and psoriasis, but it also causes skin cancers. There's a lot of research that's going on with it. So those of you who think, I'm just prone to skin cancer, no, maybe you just have a gut bacteria that needs to be evaluated and adjusted, and we probably have to look a little deeper into it. And again, when you look at the traditional cultures, when they look at how do you shift the skin bacteria, a common one from India, which I'm quite familiar, is buttermilk.
Mhm.
And then they ferment rice. It's called kanji. Kanji is where the old rice, like we generally, traditionally in Ayurveda, we don't eat old food, but the old food can be eaten as a fermented product. So the leftover rice, you fill it with water, leave it, and it's a hot place, right? So it ferments overnight in a mud pot, and the next morning you drink the kanji. It really helps your gut system. I think Korean food, you have kimchi.
Mhm. Every culture has a fermented food that's specific to that culture.
That's
You
right.
go back.
And I think that's what we need to understand is look at what your culture talks about fermented food. Now, I would say the European and the American culture is probably cheese, but a lot of our cheese is also not natural. Unfortunately, it's not like, if you look at the cheese slices, it'll say, it won't say the word milk in it because it's so highly processed.
Well, all of our cheese is homogenized and
Yeah.
what's that word? Pasteurized.
Pasteurized is,
So essentially, it's really not cultured.
it is not fermented like the cheeses that are aged cheeses, which have actually some degree of fermentation. So I think we're missing the point, and we're missing the purpose of these foods. We look at cheese as something you cannot live without, rather
You
than
melt over everything, and we're like our processed American cheese. We're not talking about that kind of cheese, by the way.
Yeah, and now I know many of you know we are very plant strong. In fact, where I'm plant based, and one of the things that I do, I don't promote so much of cheese, but I know whether I promote it or not, so many of our clients love to have cheese.
Mm-hmm.
So find the right kind of cheese and use it very sparingly. It's not one of those things that you have to do every day. Like kanji is not by the affluent families, it's not done on a regular basis. Whereas the poor people in India, they work very hard. They get very little nutrition, but they drink a lot of kanji and they're very strong.
Mm-hmm.
They're the construction workers. So really the fermentation is very important because, again, we're changing the gut bacteria. The gut bacteria has been connected with rosacea. Rosacea has been connected with Alzheimer's. So rosacea is not simply about having red cheeks and having to put an ointment there, but it's really it's a signal that you can potentially have a problem with your memory later on. And we now, a recent study came out that Alzheimer's is connected to processed foods. I mean, how much of this do we need to hear before we realize Aricept is not the solution for Alzheimer's? The solution begins way before, which is in your gut. Reduce the inflammation, shift the gut bacteria, help the immune system work against our enemies and not against us. So I think that's what we're trying to do. We can refresh and see if anybody has any questions because skin conditions are very chronic, and I think one of the most successful professions in medicine is actually, this is the holistic icon, are the dermatologists and anything with skincare. I mean, you can buy how many creams for anti-aging, whether it be for anti-aging or for acne. Acne is another one.
Acne is a bit, and that starts, you think that's normal when you're in high school or whatever. I went to a dermatologist. I had bad acne too, and I never thought it was food related at the time. But yeah, you change your diet. I don't care how old you are, your skin's going to get better. You're not supposed to be all red and blotchy everywhere.
And it should not be like you are actually having to put on makeup in order to get out in the open. A lot of people cover their blemishes, and I think that's why the skincare industry makes a lot of money. Not only do they make money on selling you anti-wrinkle cream that never works, and foundations, different types of foundation, different ways of application. And it's almost like if you cannot go out without foundation because you would look like terrible, there's a problem. There's a problem with your gut. I just want people to understand that. So what they find is there are certain specific bacteria. When you have an imbalance in the kind of bacteria, which we all have temporarily on and off, but when you have a chronic imbalance, it leads to chronic inflammation, and it can present itself as a skin condition or as an arthritis or even worse as an autoimmune state. So I think the key thing I really want people to understand is when you have a skin condition, do not focus on just seeing a dermatologist. Look at somebody who can assess the balance of the bacteria in your gut. Are there is there any inflammation? Do you have any food sensitivities? Are you eating the right balance of food so that the gut bacteria feel that they are getting fed and they actually protect you? Because gut bacteria have two things. One is they help with your metabolic rate. They actually help you get your nutrition. And the second one is your immune system. They trigger off the immune cells. So if you create a trigger with the kind of gut bacteria that you have that is pro-inflammatory, which means creates inflammation, and reduce the bacteria that are anti-inflammatory, or rather the cells, the immune cells that are anti-inflammatory, you're going to be in a highly inflamed state. So atopic dermatitis, contact dermatitis, these are not simply a reaction to food and food products. It means your immune system is overreacting because it is hypersensitive, because it doesn't have the right kind of gut bacteria giving the right kind of signal. You go buy popcorn. What is that I showed you yesterday? It has a chemical in it, polyethylene glycol, or something that you do as a petroleum product. Most people eat popcorn, don't have a rash, but if you have a dermatitis because you're exposed to some food that you eat on and off, then the problem is, yes, first of all, we don't want you to eat food that is not really food, but if you do, your body should be able to eliminate it and say, hey, this is not right. But if it actually creates a chronic inflammatory cycle, destroying your immune system or creating that degree of inflammation that you'll land up with atopic dermatitis, you'd land up with psoriatic dermatitis, or you'll land up with rosacea, then we have a problem. I think that's what you need to. And sometimes you have skin rashes would just show up and nobody knows what it is. And everybody actually gives you, whether it be an internist, whether it be a dermatologist, we always go for the steroid cream. And so we're disrupting another hormone. You do absorb steroids through your skin. And further, when you do long-term use of steroid creams, what really happens is How do steroid creams work? They actually reduce inflammation by cutting down the blood supply. And when you cut down chronically the blood supply, that area of the skin becomes thin and painful. So chronic steroids are also not the solution. Destroying your immunity is also not the solution. So I think we have to really be in tune with your body, understand why you have a skin problem rather than just give it a name and try to tame it with creams and what we call as immunomodulators. So is there anything else I'm forgetting?
No, I think you got it. My friend has her son. He's had eczema since he was like 3 or something very young. He's 7 now. And the creams don't work for him.
Yes.
Nothing works. And if he, is agitated or something, it makes it worse. It flares up.
That's true. Yes, I forgot to mention that. Every time you're stressed, your skin conditions get worse. And the best thing that helps it is hot water, but the minute you get out of the shower, it gets worse.
Right, yeah, and it's dry, it's flaky, and it itches, and you feel so bad for him. And when she's able to keep him on a really good diet, plant-based diet without like all, the soy and the gluten, like those are his big triggers, I think gluten and dairy for him, he completely is gone.
Yeah.
But, sometimes it's hard to keep a kid on that. So things happen. But
and I think, that's the sad part. We live in a world of abundance where these foods are just part and parcel of our daily routine, milk and bread. I don't think anybody dies of starvation unless they're using drugs or mentally not well. A lot of times we have an abundance of food. And unfortunately, we are eating more food-like products. And our gut bacteria is getting confused. We don't have enough of the balance of the good and the bad. Therefore, this is a chaotic state of your immune system, of your gut bacteria, and it does reflect on your skin. So skin conditions, trust me, trying to work it from outside never helps. You got to it's an inside job. Let me say that. That's the best way to put it. It's an inside job, and you need to look at who is your culprit, what is your culprit, how do you get to a point where it can actually be long-term resolution. I see it happen all the time. And getting to the triggers, how do you get to the triggers? A few things I would say. Do what is called a food sensitivity test. Now, there are a lot of food sensitivity tests out there. We like to use either Cyrex, which is a little more expensive, or the MRT, mediator release a test. And a lot of times those two tests give us early the food triggers. The second thing I would say, the other forms of really addressing it is work with a nutrition based, either a coach or somebody who's integrative nutrition. If you go to a traditional registered dietitian, they may not know it. And I hate to say that sometimes even the testing that your insurance will cover, which is through the giving antigens, needles, and telling you that you're sensitive to tree pollen and cat hair and dog hair.
Skin prick test. That is so much fun to take.
I know. The skin prick test, or even the traditional tests that you get through blood tests, there are different forms, IgE, and then this mediator release test is a little different. What I need you to understand is you need to get a test that is a little more accurate than many of those. And once you get the test result, the goal is not to say, I can have peanuts for the rest of my life. It's to find out, why am I sensitive to the peanuts?
So you want to eliminate the things that are causing the problem, but at the same time, just eliminating it isn't going to fix the gut issues. You want to work to actually fix that bacteria in your gut as well simultaneously.
Yeah, and I think to that point, you will eliminate peanuts in your teens. Then by the time you're an adult, you'll find that you'll have lactose intolerance. And then as you get older, you'll find that you cannot tolerate tomatoes. And then, so your sensitivities actually increase in number, but it all began with the first eczema that you had. And I cannot emphasize that enough. We don't know enough about the gut bacteria as yet. There's a lot of research going. They find that the babies born through C-section are different from babies born through the natural vaginal delivery, because the mucous membrane gets the vaginal bacteria. So the mother's gut health in the first trimester is extremely important to reduce the incidence of eczema. And towards the last trimester, the gut bacteria becomes very inflammatory. That's also something that they noticed in the studies. So really the child that has a lot of colic, and I think one of our clients posted an article in the group that we are finding American children are having less of a specific type of bacteria that cannot break down the sugars in breast milk, and therefore they have more colic. And of course the solution is not saying, hey, how do we get this, how do we change our lives to get this bacteria? But the solution is let's start adding this bacteria to the formula of the child. So it's like adding iodine to the salt because we're a poor iodine, the soil has not enough iodine. It's almost like let's just replace it but not find out why we don't have enough of it. So once again, though, what we encourage you to do as a person who has any of these chronic conditions is work with someone who can get to the root cause of why you have it, because that's your blueprint. Your gut bacteria is not going to look like somebody else of your age or the same sex, and sometimes even not in the same home. We've done a lot of clients come as couples to us, and we find when we do the testing, the wife has a completely different gut bacteria than the husband. Most of the time, they're very similar. I've said that also before, very similar because they're eating similar food, but the stressors are different for each. If one is working outside and one is doing a stressful job, the stressors are different. So you need that assessed, and your diet changes has to be based on trying to feed the gut so that it can become healthy, and therefore your skin conditions actually resolve. I'm hoping that makes sense, and if there are any questions, I will take them now. Looks like today we don't have too many. Hi, Nancy, how are you? So if there are any questions, I'll be happy to answer them. Is there anything else I'm forgetting, Marina, that I should say, because we see skin conditions all the time? And,
no, I mean, just it's a trigger. You need to look at why it's being caused, always going back to the root cause, and just understand that, because eczema, all these things are linked to other diseases down the road. That's like your first alarm. So be aware of that. Don't just brush it off and say, oh, whatever, I can get a cream. You're still going to have the same process going on, and it's going to start to domino effect on everything else in your life down the road. So.
And I think the other one is also the conditions like hidradenitis suppurativa, which you see with insulin resistance. Again, insulin is a gut issue. You got to look at the gut bacteria. It can be a gut issue. It can be a receptor resistance issue. We find that if somebody has a skin condition due to insulin resistance and we just work on their gut, literally their skin condition will improve within a matter of weeks. So again,
there's hope out there.
Yes, there is hope. And people with chronic skin conditions, please understand there is actually a solution that will work. When I say solution, not a physical solution, but there is a solution to the problem. And really, it's just gut deep. I guess that's what our topic is all about. So I'm going to wrap it up today since we started a little late, and we're going to try and get as much as information. Do you have a point that they can take home from a nutrition standpoint to help their gut?
Of course. So we're going to talk about sauerkraut. You had mentioned fermented foods. So sauerkraut's a really good one. I want to make it clear, when you're getting sauerkraut, if you're getting it from the store, check the label and look at the ingredients, because if it has vinegar in it, it's not naturally fermented, meaning it doesn't have the probiotics in it. So natural sauerkraut has all those probiotics in it that help your gut and all that kind of stuff. If it's got a vinegar base, it's basically been kind of quickly pickled, essentially, and it doesn't have that probiotic benefit. So it needs to have just the vegetables, spices, salt, and water. That should be the only thing in your sauerkraut. So a lot of health food stores carry it. You can make it at home. I've done it before. It's not pretty easy process. So sauerkraut, a lot of good probiotics are in there. So eating it with your food, it also has digestive enzymes. So when you're taking a pill for digestive enzymes and for probiotics, this is kind of another way to get a different variation of that naturally. You said you can, when we were putting the that one bacteria for the colic into the formula, that's one strain. You have trillions of strains.
We have 16 trillion, they think. You can see Michael has a question about what about the gut shots they sell. Michael, I don't know what gut shots. Are they probiotics? I don't know what gut shots you're talking about.
Is it like a drink? I think, is that a drink that you're talking about? Maybe that's what it is.
Yeah, I'm not really sure what kind of a gut shot. So here's the thing. There are no gimmicks out there, okay? There are no gimmicks that will fix you. Even a probiotic, I think I've mentioned in a previous podcast. You take a probiotic, you take a gut shot that has enzymes and bacteria. What really happens is that's bacteria introducing into your system. Now, bacteria are like human beings. They're going into a subdivision to look for a home. And if they find that the home has a lot of thugs and not a safe place, that's not a place that they will stay. That's not the place. If your gut does not give it the food it's looking for, you're wasting your money on your probiotics because in the next poop, it's out. I hate to say that, but that's the truth. So ginger, beet, farmhouse culture. So again, like I said, you can eat whatever probiotics, but if you're not eating food to feed those bacteria, they're not going to stay in your gut. You're going to have to lifelong take probiotics. Do you understand that? If you say, I want to eat the way I want, but I'm going to take probiotics, that works in the short term, but you're going to be spending a lot of money, and a good probiotic costs a lot of money. Truly, it does. It's one of the more expensive supplements you get. And as you know, we're not a supplement-based practice. We really try to get to your blueprint and tell you what will work best for you and how long you need to do in order to alter your diet, your stress levels, your environment to get to the point of optimal well-being. Everybody at different age has an optimal well-being, and we try to get you there. So it's not about just taking a shot and saying and eating whatever you want. You got to take the shot and you got to feed the shot. Does that make sense? Because you're taking bacteria and you want to feed that bacteria so it stays. So one shot actually lasts you for a week rather than having to take a shot every day. I hope I answered that question for you, Michael.
I think it's a drink, though, that like you take maybe before you eat or something. Michael, look at the ingredients and see what's in there. I'm kind of getting like an idea, like maybe it's like a kombucha type thing or something maybe, but just, yeah, take a look at the ingredients. Make sure there's like not added sugar and stuff like that in there too. That's always an issue.
So any fermentation process, sugar is an end product. Okay, so you'll find with the alcohol, sugar, if there's sugar, there's fermentation. That's how carbohydrates gets fermented. So there will be a little bit of sugar, but when they add sugar to make the drink palatable, that's when the kombucha is no longer kombucha, right? Kombucha is pretty much like drinking alcohol. But most of the kombucha that's been commercially sold has added sugar, and you'll find that if you have a skin condition and you drink kombucha that you buy because you like the taste, your skin condition will flare up. So to answer, it's good that it doesn't have any sugar, but Michael, one of the things is if you're drinking it for a specific reason, what I find is when you take the right kind of probiotic, let's say you have skin conditions or weight issues, you take the probiotic, the weight issue goes away, the skin condition gets better if it's the right kind of probiotic, if it's the right kind of fermented food. If you're actually gaining weight on a probiotic, you probably have the wrong one. So he's got 110 billion.
That's a lot.
Yeah, that's a lot. Yeah, anything over 70 billion is pretty good. And it's got what is it? It's a colony forming units with lactic acid, so the lactobacillus. So again, it's only one strain. There are so many strains, and you have to look at your balance and give the right kind of probiotic that will work for your gut. So just taking something off the shelf, it's a hit or a miss. It's like taking what can I say, without actually seeing, you see, when we have somebody comes to us with an infection, we actually look at what is causing the infection and what antibiotic does it respond to, and then give you the right kind of antibiotic. If antibiotics were available over the counter, people will be taking, all kinds of antibiotics because it's just more expensive or they heard better things about it. And that's what I think is happening with probiotics. People are just buying stuff because it's easily available to them, or it sounds better, or it's more expensive. But if it doesn't have the diversity, remember we've spoken about the diversity of your gut bacteria, if it doesn't have a diverse population of the gut bacteria, and if you're the kind that needs a specific type, it may be a hit or a miss depending on how you buy the probiotic.
So make sure you're increasing your fiber, your fruits and vegetables to give that probiotic the environment that it needs to thrive and to actually stay there. Otherwise, like Dr. Chellam said, it's just kind of going to go right through you if you don't have the right environment.
And I think the fiber is being sold now as a prebiotic, right?
Yeah,
so even that we have decided to commercialize. But if you can, and the reason for that is most of us say we don't have time to cook vegetables, have vegetables, or eat the root vegetables. I don't like sweet potato, I don't like rutabaga. We have all kinds of excuses. But instead of spending money on supplementation, why not just eat a certain amount of vegetables on a daily basis? And if you have conditions like skin conditions, just take the probiotic for so many months as you change the bacterial environment. And usually I've noticed that gut issues on an average take about 18 months to resolve. When you do what we call the renew and repair of your gut through a process, a supervised process, that time should get shortened if you're able to stay with the diet that has been prescribed for your gut bacteria. And I mean, not even talking about you, it's almost like I have to feed your gut bacteria, and that's what we look at. Mm-hmm. So it's anything with the skin. The bottom line, anytime you have a skin issue, whether it be acne or eczema, which we think are simple conditions, or more serious ones like the psoriasis and skin cancers and hidradenitis, which can involve extensive areas of the skin, even atopic dermatitis, look into the gut. You can use the creams for acute management, but always resolve the underlying cause. Otherwise, you start acne at the age of 13, it never gets done. Even at 40, you're breaking out. People say it's hormonal. To some degree, it's hormonal, but it's really coming down to what your gut bacteria, how your gut bacteria disrupts your immune process, and the immune process actually creating a problem. I think I will wrap it up with that at this time. And if there are any further questions, go ahead and post them and we'll take the time to answer. And once again, thank you for joining us. As you know, we are Holistic and Integrative Center of Novi. As the name says, we are in Novi, Michigan, or holisticicon.com. Make sure you subscribe to our podcast. I got to do all these marketing stuff, right? By the time I finish this, please subscribe to our podcast so we can continue to put out good content. Make sure you like our Facebook page, which is Nisha Chellam, MD. Join our Holistic Icon community on Facebook. Check out our website on holisticicon.com and try to learn more. I am revamping the website. It'll be coming up in the next few weeks. And if you can, look on Eventbrite for any of our events. Many of them are free because I'm very interested in creating that education and empowered patient crowd outside. So we have one on thyroid and hormones. We have a workshop where you can actually sit down and go through your whole history, and we'll be able to give you a general diet that you can actually take home and implement. So once again, thank you for joining us. We'll see you next week. Take care.
Bye-bye.